Back now on Newsmax Prime, J.D. Hayworth with Morgan Thompson and Nick Tate, Newsmax Deputy Health Editor and author of the book, Da Vinci's Baby Boomer Survival Guide. Mother's Day is coming up this weekend, but I understand there's a startling new report on women's health.
Yes, gentlemen. The U.S. is ranked worst of developed countries for maternal health care, according to the Save the Children's 2015 annual report. Worse still, we're down 2 spots from last year. According to the report, U.S. women are 10 times more likely to die from pregnancy-related causes than countries like Australia. We also ranked low in children's well-being, and even worse was our ranking for maternal health. Nick, are you as surprised by these findings as I was?
Very surprised. You know, we hail the U.S. healthcare system as one of the best in the world. We spend twice as much per capita on healthcare here than virtually any other country, and yet we find studies like this that indicate quality of care and maybe access to the care of the problem. I should also point out that, you know, we don't do very well when it comes to life expectancy, the death rate from preventable diseases as well. So there's obviously some ground we need to make up here.
As I have heard from some of the medical profession, though, Nick, they say when we take a look at numbers for births in the United States, we are really working hard on neonatal care and rescue, and we attempt to save babies that other places might not have that opportunity.
That's true, J.D. Just this week, just today, in fact, there was a piece of research that came out that said an infant can survive at just 22 weeks because of some of the neonatal care. Now, the real problem here for women, for pregnant women, is many still do not have either health insurance or proper coverage in prenatal situations. So thousands of women show up at ERs every month, literally, with 9 months pregnant and not having had any kind of a prenatal visit. So getting people insured, getting them to healthcare providers, and recognizing that showing up ready to deliver when in a healthy state is going to be better for women and child too.
Now, switching gears a little bit, in researching this story, I found out that women are more likely to die from heart disease than breast cancer. So much so that actually 1 woman in 3 dies from heart disease, and 1 woman every minute, a study found in 2011, actually dies from heart disease. This was shocking to me. And with Mother's Day coming up, what can we do to protect ourselves against this silent killer?
Well, you know, that research really points up that women in many ways have been missed by the healthcare system in this country. You know, a lot of clinical research that's gone into new treatments and drugs has involved men, has not involved women. Right. We still tend to think of heart disease as a man's disease, when in fact it is the leading killer of women, as you say, killing between 3 and 5 times as many women as breast cancer.
You know what I found most surprising is the incidences of cardiovascular disease are actually increasing in women. I believe it's 1.3% per year, and decreasing in men. I'm assuming maybe that's more stress, workforce related, but I found that shocking.
Well, it's 2 reasons. Men are getting the attention. A man shows up to a hospital or doctor with a sign of a heart attack or heart condition, they're considered immediately as a heart patient. For women, that's not true. The second thing is that both men and women we are all becoming more overweight in this country, increasing the risk for heart disease and diabetes. So some of that's lifestyle related, but the bottom line is that doctors and women themselves need to be recognizing this as a danger.
So, Nick, are you saying for that special woman in our lives, wives, the mothers of our children, our moms, we should not be giving them a box of candy on Sunday?
No.
I would never say such a thing, nor would I suggest that we give them a membership to a health club. However, there are things that men and women can do together, working out, eating well. You know, a box of chocolates isn't really going to make the difference between life and death, but eating a box of chocolates every day might. So, for instance, things you can do in the household for the women you love. Join an exercise group, get active together, eat well. Those kinds of things are important. And most of all, talk about what you can do. Some of these risks are genetic, they're familial, but there are a great number of things we can do from a lifestyle perspective that are good for the body and the mind too.
Well, something else that always comes up in women's health, breast cancer, mammograms, prevention. What are we hearing now? What's the latest?
Well, in fact, just last month there were new recommendations that women 50 and over do not need mammograms more than once every 2 years, and that women under the age of 50 should not be routinely screened. But of course, the American Cancer Society and others say that that's not true. The bottom line is for women who have a history of breast cancer in the family, who can get genetic testing to find out if they're at risk, should have mammograms more frequently. This is one of those cases where one-size-fits-all prescriptions for breast cancer mammography screening really don't fit everybody, so you need to talk to your doctor, you need to assess your risks and do what you can from a lifestyle perspective, and mammography screening is a part of that preventive system as well. So don't follow the one-size-fits-all guideline from the federal government. Assess with your doctor what your risks are and keep yourself safe.
You know, I've heard the medical community is really divided on that, because my doctor
Yes.
said absolutely after 40 you should have a mammogram every year. So that's been a really divisive issue.
It is. You know, what the proponents of more mammograms point out is that since the mid-'80s, when mammograms really became very widespread, the breast cancer death rate has gone down by about 35%. And the advocates like the American Cancer Society believe, in fact, that if in fact women over 40 were not routinely screened, we'd see about 6,500 breast cancer deaths a year. So really, you can't follow the advice of these broad spectrum, recommendations from the government. You need to assess your individual risk with your doctor's help.
Well, men or women, you can learn how to survive the baby boomer financial crisis with the newly released book, Da Vinci's Baby Boomer Survival Guide, by going to babyboomer711.com.